Hello, my name is Pharmacist Michael, and this channel is all about happy, healthy living. And today I'm going to talk about something that's pretty severe, maybe more severe than you think. And that is, I'm going to talk about 3 of the most prevalent eating disorders. If you're into health and wellness, please subscribe to this channel. Do you or someone you know have an eating disorder? What are the most common types of eating disorders? What are the treatments available for these eating disorders? This video will concentrate on the 3 most prominent eating disorders. These include Anorexia Nervosa, Bulimia Nervosa, and Binge eating disorder. We will explore these disorders one at a time. The most important thing to remember is that getting professional help is crucial if you suffer from any of these conditions. All of these disorders can progress to death if not treated. So let's start with anorexia, probably the one most people hear about. It's the most well-known eating disorder. Although estimates vary based on the study, it is estimated that the lifetime prevalence rate of anorexia is about 0.8%. It is important to note that eating disorders are often underreported in the literature because many with these conditions do not seek treatment. Patients with anorexia have significantly low body weight in relation to their age, sex, and physical health. These individuals have an intense fear of gaining weight and becoming fat. They also underestimate the seriousness of their low body weight and have a distorted view of their body shape. There are 2 types of anorexia. There's the restricting type. The patient has not regularly engaged in binge eating or purging in the last 3 months. And there is the binge eating purging type. In this one, the patient has regularly engaged in binge eating or purging in the last 3 months. What are the signs and symptoms of anorexia? We can split the signs and symptoms into 3 specific categories. The first category is psychiatric. These symptoms include a preoccupation with food, cooking, and nutrition, a fear of weight gain, restlessness, social isolation and withdrawal, ritualistic behaviors, and irritability. Many of these patients also suffer from other psychiatric disorders such as depression, anxiety, or obsessive-compulsive disorder. What are the eating behaviors? Well, people with anorexia often waterload. They often eat a vegan or vegetarian diet. They skip meals. They restrict their calories. They cut their food into little tiny pieces. The physical signs are they're underweight or emaciated. They often suffer from constipation or abdominal pain. They're lethargic. They have dry skin and brittle nails. They may have yellowish skin. And they may suffer from electrolyte imbalances. They may be infertile or have premature births. They may suffer from bradycardia, hypotension, and cardiac arrhythmias, osteoporosis as well. The risk factors for anorexia, some studies suggest that genetics may be a factor in the development of anorexia. We know that people with diabetes are at higher risk. Those with emotional stress, we know there's a link between emotional stressors such as a death of a loved one or divorce of parents and the development of anorexia. Parental pressure regarding achievement and appearance is a risk factor. participating in sports that are associated with thinness, such as ballet, wrestling, or running, peer pressure and social media. Young teens are often bombarded with perceived success based on unrealistic body imaging. This is going to come up again in this video. Age is also a risk factor. Peak onset is early to mid-adolescence. We know that gender matters. Lifetime prevalence in females is 0.9% and only 0.3% in males. You're 3 times more likely to be anorexic if you're female. What do we do to treat it? We should accomplish treatment using a team approach. Physicians, nurses, dietitians, therapists, and other health professionals with experience treating eating disorders should be employed. I would throw pharmacists in there. A dietitian should provide nutritional rehabilitation to avoid refeeding syndrome. This is done by slowly increasing the patient's weight. The most effective treatment for anorexia in adolescents and young adults is family-based psychotherapy. The use of medications in the treatment of anorexia is controversial, and it should not be started until the patient has gained sufficient weight in most cases. Things that we may use to help these patients are multivitamins, agents for constipation, abdominal pain and bloating, calcium supplements for osteopenia, medications used to treat coexisting conditions such as depression, OCD, and anxiety may also be initiated when it's safe to do so. In severe cases, hospitalization may be necessary to correct dehydration, electrolyte imbalances, cardiac arrhythmias, or severe malnutrition. One final comment about anorexia. Many people are unaware that this disorder has a high mortality rate. In fact, a meta review of all-cause and suicide mortality in mental disorders came to the following conclusion. Those with highest all-cause mortality ratios were substance use disorders and anorexia nervosa. Let's talk about bulimia nervosa. Bulimia is an emotional disorder that involves an obsessive desire to lose weight. Bulimia is characterized by extreme overeating, followed by depression and inappropriate compensatory behaviors to prevent weight gain, such as excessive exercise, misuse of laxatives and diuretics or enemas, self-induced vomiting or purging, and fasting. The severity of bulimia can be categorized according to the frequencies of these inappropriate behaviors. Mild is an average of 1 to 3 episodes a week. Moderate is an average of 4 to 7 episodes per week. Severe is an average of 8 to 13 episodes per week. And extreme is an average of more than 13 episodes weekly. What are the signs and symptoms of bulimia? As with anorexia, the signs and symptoms of bulimia can be split into categories. Let's start with psychiatric. These symptoms include substance use disorders, anxiety disorders, impulsivity, depression, and mood fluctuations. What are the behaviors? A preoccupation with food and eating, laxative or diuretic abuse, compulsive exercise, poor self-image, and self-induced vomiting or purging. These patients often lose control over food intake. They eat large quantities of high-calorie food such as cake and ice cream, often attempting to combat dysphoric mood states. Binging helps with anxiety and dysphoria in the short term, but makes them feel guilty. Patients with bulimia often conceal their binging, planet and eat until they are uncomfortable. What are the physical signs of bulimia? These patients are normal to slightly overweight, loss of tooth enamel from purging, an increase in dental cavities, lethargy, electrolyte imbalances, amenorrhea, hypotension, bradycardia, and a prolonged QTC interval, and osteopenia and osteoporosis. The risk factors. There is a strong genetic predisposition according to studies. Physical and sexual abuse victims are more prone to bulimia. Emotional stress increases your risk. Participation, again, in sports that are associated with thinness, such as ballet, wrestling, or running. Peer pressure and social media. Again, social media and pressure from teens can make people believe they need to be skinny to be successful. Those who are impulsive, those that have inadequate stress coping skills. The incidence is reported to be 2.6% in females and only 0.5% in males. The peak age of onset for bulimia is 16 to 20 years, and the mortality rate is about 1%. Early detection is a critical factor in recovery. To treat bulimia, we also need a multidisciplinary team of professionals. Psychotherapy has the best efficacy for this disorder. This process can take 4 to 5 months to complete. SSRIs such as fluoxetine are also used to reduce binge purge episodes. Dietitians can be instrumental in creating nutritional plans for these patients, as adequate meals can decrease food craving. Some organizations can help get bulimia patients the help that they need. 2 great options are Overeaters Anonymous, www.oa.org, and bulimia.com to help locate support groups, www.bulimia.com. Okay, and finally, we're going to talk about binge eating disorder. Binge eating disorder is a condition in which the patient eats a more considerable amount of food than most people would in a similar time period. Unlike bulimia, these individuals do not regularly employ compensatory measures such as purging to counter the binge eating. They often eat rapidly until they're uncomfortable. Binge eaters often eat even when they are not hungry and eat alone due to embarrassment. They often feel depressed or guilty after eating. To be diagnosed with binge eating disorder, the binge eating must occur at least once per week for at least 3 months. The severity of BED can be classified the same as the other eating disorders. Mild, an average of 1 to 3 episodes weekly. Moderate, an average of 4 to 7 episodes weekly. Severe, an average of 8 to 13 episodes weekly. And extreme, 14 or more episodes per week. What are the signs and symptoms of patients with binge eating disorder? These patients are slightly overweight to obese. They have a high level of emotional stress. They have a high incidence of gastroesophageal reflux disease. They have a presence of stretch marks due to weight changes. They may have gallbladder disease, poor impulse control. They have feelings of guilt, as we talked about earlier. They often have comorbid anxiety or depressive disorders, hypertension, cardiovascular disease, hyperlipidemia, and hyperglycemia. These patients are very prone to diabetes. What are the risk factors of having binge eating disorder? Again, there seems to be a genetic component with binge eating disorder. Family and twin studies have shown a 57% heritability. Females, again, have a higher incidence, 3%, than males, 2%. The age of onset peaks at 18 to 20 years of age, but this disorder may occur later in life. Many of these patients have a history of yo-yo dieting. They have large fluctuations in body weight over time. There is a strong correlation between binge eating and obesity. About 50% of obese individuals report binge eating as one of their problems. We treat binge eating disorder a lot like the other disorders. We use a multidisciplinary team of professionals, and psychotherapy has the most significant effect on binge eating disorders. But we do use drugs more often in this disorder. Lisdexamfetamine is the only medication that's FDA approved for binge eating disorder. It has been shown to decrease binge eating days, binge eating cessation, and global improvement compared to a placebo. We also use drugs like topiramate, zonisamide, some of the SSRIs, such as fluoxetine, sertraline, citalopram. We may employ orlistat for these patients and Contrave, which is bupropion naltrexone. I actually did a video on Contrave you can find right on this channel if you're interested in that drug. Eating disorders can cause endless problems for patients who suffer from them and the families involved. Our society has caused our young citizens to believe they need to look a certain way to be popular or successful. Social media has amplified this lie. The truth is, we all have a special gift to give, and it has very little to do with our weight or body shape. I urge every person watching this video to begin to love yourself as you are. Determine your gift and take steps to develop it, and share this gift with those who will benefit. Our body shape is something that we're born with. We can't all have the body type of the stars. The best thing you can do for yourself, again, eat whole, healthy foods, drink plenty of water, exercise 5 days a week for at least 30 minutes, and please be sure to get enough sleep. If you think you may have an eating disorder, get help. There are many sources of help available. If you need help finding treatment for an eating disorder, please send me an email at michael.brown@sunshinentc.com. If you know someone who you think would benefit from this video, please send it to them. If you've enjoyed this video, please give it a thumbs up and subscribe to my channel for more happy, healthy information. My name is Pharmacist Michael. Be happy and be healthy.